Hi everyone, welcome to another video of Talking Dental Innovation. My name is Justin. I want to welcome my customers in New Brunswick and Nova Scotia. So for today's video, we'll focus on time. So we'll talk about different things that we can do throughout your day in the dental clinic that will save you those little minutes that can add to be, a big impact at the end of the day and does snowball for the rest of your week, your month, and your year. So time is such a big factor. We strive to save time throughout the day, and we thrive as well to make sure that we utilize our time as efficient as possible. There's many tools out there to save time. Either it's programs on your computer, or it's different products that you can use to save time. And all these little things might seem small, maybe 30, a 30-second here or a minute there, but they do add up at the end of the day. So what can we do if we have more time, right? So again, time is so important, but we want to utilize it efficiently. If we have more time and you want to add, more patients to your clinic, well, you can do that with extra time. If you want to save maybe some loose in your schedule, you can do that with more time. If you're somebody who says, you know what, I'm busy enough, I don't want to grow my practice more than it is now, but you know what, time can be used to make your day at work less stressful for you and your staff. So we're going to talk about, like I said, around 20 things today, just to make sure to cover pretty much every little single basis of what you would do in your day to day. And there's little pieces here and there that you can save time. And again, maybe saving a minute here won't be, much of a factor, but if you add it up all together, it does make a pretty big impact. So we'll start off today by talking about your restorations. So again, these items are not, they're not as simple as, okay, I'm just going to adopt this today and that's all. It's going to take some time and it's going to take some effort to adopt these in your regular protocol in your regular day. So the first one is multiple restorations at once. I know it's easier said than done, but if you can, work on your protocol and making sure that every time you have a patient, it's really well discussed to do multiple restorations on the least seating as possible to do the work. If you notice your patient has multiple cavities, it's going to be better for you to do as many cavities on one seating as possible instead of doing once, doing a cavity every month or every couple of months. And I know sometimes it's not an option, but if it is, it's going to be well worth it. Just having your patient sitting down and getting up and getting another patient in, that time in between patients, if you do this for multiple patients inside your practice, it will add up, and it will add up very, very quickly. Here, we're not talking about a minute or two of time savings. We're talking about, hours in, easy hours in a week. So if there's any way to have that discussion of patient education and making sure that they're very comfortable, okay, this is your best situation. You have, 5, 6 cavities to take care of. We'll do all of them at once. It's going to be a lot more efficient just by rotating your, we'll stop or limit the rotation of your patients in and out of the chair. The other one is, adopting digital dentistry. What I mean this time is an IOS scanner, so an intraoral impression taking scanner. So this, again, this could be great for, most people or just for some. It all depends how comfortable you are by utilizing technology. And as well, all depends on, this, of course, I mean, it's a patient education and it's a patient experience tool. But if we just talk about saving time, it is going to be quicker, than just utilizing a traditional impression. The biggest thing as well with this is you're going to save a lot of time from returning some restorations to the lab. So when I was, with the lab world, we had a statistic: 5 to 7% of all restorations or products came from the lab were returned for adjustments or remakes. With a IOS scanner, it was below 1%. So on the long run, throughout a year, you are going to cut down on your remakes, and it will make a big difference. So again, it all depends on very comfortable you are with digital, but I believe almost every clinic should have an intraoral scanner. Doesn't matter if it's a complex one or a simple one, but this will save you time on the long run if it's utilized properly and if it's integrated in your protocol properly. Another great way to save time is utilizing a bulk fill material. So what I mean by bulk fill is utilizing a composite. Let's say you're doing a class 1 or class 2 restoration, instead of doing increments of 1 or 2 millimeters and then taking the time to let that set with a curing light and knowing just building up, you utilize a bulk fill to really cut down on those layers. Again, this is not a product made for everybody, but it is a great tool for you can save those, 1 minute, 2 minutes per restoration, and it will save a lot of time. There's great products out there that you can utilize that have been proven, but it is going to save you a lot of time, especially for multiple restorations. Or number 4 is proper inventory management. So you want to make sure that you're not going to run out of supplies, especially now during COVID. There was a lot of products that were either discontinued or put on hold from the manufacturer. Sorry. So you want to make sure that you're not going to run out of supplies or be surprised that something ran out that usually you had tons of. Gloves and bibs. Usually the suspect in these last few months. Again, making sure you have all your supplies. You're not going to have to cancel a patient because you ran out of composite or bond, or you don't have that proper shade. Sometimes these products that are very specific, I'm talking about a very low supply, Denton color. It might be, very, I wouldn't say unpopular, but not as common as, let's say, an A2 composite. So this could be a product that, you make sure you manage your cases well in advance to give yourself some time to get those products in your clinic. Sterilization protocol, utilizing cassettes in a hydrant system is a very, very good way to cut down on your sterilization protocol. You're going to save so much time by utilizing a full cassette and hydrant system compared to just bagging and sterilizing. Again, this is a very good system that I believe everybody should use. This is not a preference. I believe that the cassette system is 100% better than just utilizing bags. It doesn't take a lot of space and it doesn't take a lot of time for your staff to utilize as well. And with this as well, adding on an extra team member just for sterilization. Instead of everybody doing their own steri, you have one person that's focused, that's efficient at doing their sterilization. So at the end of the day, this, your hygienist, for example, could, maybe even have some extra time to take an extra patient in that day instead of losing those 5-10 minutes every time there's a patient of running through your cycle of sterilization. When you're considering a lab, this is very, very ideal. Again, going back to my lab days, making sure you have a consistent lab. I know it's easier said than done, but having a great consistent lab that's going to give you, the best products, the best fitting, the best colors to you is going to be huge because, again, I know everybody had the situation. Patient comes in for crown seating, you sit on, the crown sits down on the tooth on the abutment and it doesn't sit. And you have to send that crown back, or you have to spend a lot of time adjusting that crown. If it's zirconia, it's going to take even longer. So again, number 7, make sure that your lab is very consistent. And if it's not, why, right? Some labs will actually be very afraid to tell you that maybe it's your impressions. Maybe it is your impressions that's the issue. And they're never going to admit it. So if there's any issues, ask your lab, be honest. Is there something wrong with my impressions? Am I doing something bad with my color management, with my shades? The communication with your lab is very, very important. As well, number 8, utilizing an office administrator. And if you have a bigger, clinic or a smaller clinic, utilizing an administrator to really take the pressure off the dentist on many, many tasks that might, let's say take time, or let's say a dentist loves working, could put in a lot of hours throughout the week, but needs to take Friday off to do a lot of administration work. Well, it could be worth of, having the doctor in the chair instead of doing the paperwork. So hiring a great administrator to do hiring and to taking care of the paperwork and looking at the numbers and everything. but this could be a very, very good investment. Again, it's looking at all the options and all the numbers, but it could be utilized very efficiently for a lot of clinics out there. See your production goals and review and adjust. Again, this goes with your administrator, making sure that you're focused every day on your goals and making sure that you achieve them. Again, it's easy said than done, but it's going to save you time. So it all comes to reviewing and managing your business. But looking at your goals every morning or every week, I suggest every morning, will be very, very efficient. In-house mailing, it goes with your iOS scanner. If you are having, let's say, issues with your lab, or let's say you're doing a lot of posterior crowns, I really believe that there's a place for every piece of equipment from the lab world. I do really respect the artistry of our lab technicians, but maybe somebody that you like to do a lot of posterior work, or if there's simple interior crowns you want to do, in-house mailing could be very, very efficient for you and for your patient, especially somebody that's comes from out of town. We have all of those options available to you. Keeping instruments sharp. So number 11, sorry. Keeping instruments sharp. So this is so important for hygienists. If your instruments are not sharp, if you don't take that, half an hour a week, 45 minutes a week to sharp your instruments, it's going to add up pretty darn quick throughout your day of just, really working a lot harder than you should when you're scaling those teeth. So keep your instruments super sharp. Instruments now, the metals are getting better and better and better. We sell a grand variety of instruments, and again, most of them now are very, very good, but you do need to keep them sharp. So yeah, sharp your instruments. If they're worn out, get new instruments, but again, sharpen them every day. Get good techniques every week. If you're doing every day, great. But utilizing those techniques to make sure that you are saving as much time as possible. And again, just looking at how many minutes you've been scaling. If you notice that your scaling time is wrapping up, maybe it's time to look at your protocol. Recalls and confirmations. So this is huge to saving time. So if your recalls are not up to par, if you have a lot of holes in your schedule, this is the worst killer of time. Let's say once a day you have a cancellation, and once every 2 days. For that hour, for that canceled patient, you take that throughout the year. That's an incredible amount of time. So there's tons of different programs out there that you can utilize. And we have a great one, Recall Max, that you can utilize inside your patient management software. That's going to work great with you. Again, not for everybody, not for every software, but most. But again, it doesn't have to be a full-blown software. You can just adopt these little things that's going to be making a big difference inside your clinic, just to make sure that the first thing you do, there's no holes in your schedule, right? I'm hearing more and more of my customers in New Brunswick and Nova Scotia. We're booked until November. We're booked, 8 months out, a year out, a year and a half out. Well, geez, that means that every minute is very important to you. If you realize you have an hour that's out, well, geez, an hour a day, it's first of all, it's a lot of money. Second of all, that could be a lot more patients that you could have seen. Instead of booking 8 months out, you could have maybe booked, 7 or 6 months out. So again, recall, very, very important. So for every team member, so number 13, every team member, to take 15 minutes in the beginning of the morning to look at their treatment plan. So I'll give you one example. Let's say your patient needs nitrous. Well, to make sure that the nitrous unit is going to be free, that's well working. Maybe there was something wrong the week before, the day before, and you forgot to that it needed to be fixed. So if there's anything that you might need for that patient that could be a little bit out of the ordinary, it's very important to make sure that everything will be set for that patient. Utilizing the Zerk color method tubs, and this is a very, very good one as well. So the Zerk color method tubs is a very great system to really utilize your storage cabinets inside your ops. You want to make sure that all your kits are already in those tubs. You save a lot of time instead of just going inside your stereo center and building those tubs for every single patient. You keep those tubs ready, and then you just replenish what you've used. So again, this is a very simple a way to save time, but it is so important when you're doing your treatment. I mean, if there's a change in procedure, the assistant just has to grab the other tub and you continue your procedure instead of getting out of the op, grabbing a new kit, or the worst, has to build a new kit or waiting for instruments to sterilize. So you make sure that everything is inside your op. Every kit or every procedure possible is ready to be converted, right? So the CertColor method is a great way to do this. You don't, if you say, well, I still do it with just regular bags, fantastic, right? As long as you have all those, options in your op that you can switch from treatment to treatment without losing a lot of time getting up and running after instruments, you have it. Taking advantage again with dental cabinets. This is a part in my other video, we talked about this. This is a very, very big feature that a lot of customers don't take advantage of. A lot of clinics spend a lot of money to really to buy these cabinets, but not utilizing the full potential. They're made to be stored and be efficient in a really ergonomic way. So please look at the entire cabinet. Let's say you have 8 cabinets. Okay, let's really be more efficient here. Well, let's work together. Let's me, you, and the ADEC rep work together to make sure that you're utilizing the full efficiency or organizing your cabinets the best way possible. And this, again, the CertColor method comes in this as well. Utilizing airflow technology. So this is a very interesting one, and this came from a few of my customers that was utilizing the airflow system from U-Friedy, and the airflow is kind of like that powder sandblaster. So the reason where I find that is really saving a lot of time is my customers that said that we're having a hard time even using an ultrasonic cleaner or a power scaler to really cut down on that really very hard to difficult tartar to remove. They were utilizing the airflow to really blast and hit those areas, and it was making all that tartar very brittle. So a very interesting way to save time, because again, if you're utilizing 20, 30 minutes to take off that tartar, but it could have been in 5 minutes, it's a big deal, even if it happens once a week or every couple of days. So an airflow unit from U-Friedy could be that extra tool in your arsenal to tackle those those big situations where it eats so much of your time. Patient education. So this is a very big one. As dental professionals, you could be there and have a conversation with a patient for a very long time. Some clinics have a coordinator to talk about different procedures, but most of the time you talk to your patient right when they're in the chair. And another video, we talked about patient communication. It's so important to utilize images inside your op to really cut down on that time and make the patient understand a lot quicker of what's going on in their mouth and what the best treatment would be for their needs. With that, having a TV or any type of educational material inside your waiting room is a very valuable piece of marketing material, or piece of communication material, I should say, that will cut down on the time because the patient's already going to know the gist of maybe a treatment you want to talk about. They've seen it on the TV, right? So these are all items that you can utilize. The time the patient is in your waiting room, he's waiting anyway. He might as well learn, about dentistry and be more passionate about his dentistry. Utilizing the reception in the most efficient way possible by not staying too long on the phone, right? Receptionists and office administrators are so busy. They have to take care of multiple items, they have to take care of insurance, of scheduling, talking to the lab people. There's so many things that they need to take care of. And the last thing they want to do is, talking on the phone 10, 15, 20 times a day of, okay, how much is this going to cost me? What do you charge for a hygiene appointment? I broke a tooth. How much is this going to be? Can you explain to me what this is? You know what? This is all time that, you could spend the time with your patient to really explain properly and book time in the chair that's going to pay for your clinic, right? There's no point of the front desk people to spend 15, 20 minutes on the phone. So, really utilizing proper protocols when somebody calls in, and make sure that they are booked in the clinic to see you and diagnose the problem, specifically, and not having the receptionist deal with it on the phone. And for the last one, and this is a very tricky one, it's utilizing a contract for your technical service for preventative maintenance. Again, it's very hard to find out when a piece of equipment might let go, but this is where preventative maintenance comes along. It's the same thing with, treating your patients. You want to make sure that your patients comes in every 6 months to a year to make sure that if there's any issues, you catch it before it happens. So the last thing you want is a down compressor or your handpiece that let go, or you're missing a handpiece for a treatment. Now you're waiting for your sterilization. You're wasting time. Your pan is down. You're losing money. You're losing time. There's so many things that it's going to cost you a lot more on the long run. By fixing, an issue that could have been prevented, but it's going to, you're going to lose a lot of time as well, and time is money. So maybe utilizing a maintenance contract, it is going to save you some time on the long run, which again is going to be just better for everybody in the clinic, because you're not going to be waiting for anybody. So again, thank you so much for your time. If this helped out a lot, or a few things that you can adopt in your clinic, that's great. These are 20 items that I mentioned. If you can save, 1 minute per operator for every day, you can look at, a decent amount of time. It could be even be an hour a day. So it is, quite the savings. An hour a day, you can probably look at around, an hour a day, a patient an hour, 250 days of work a year. It's 250 patients, or it's an extra 250 emergency calls that you can take, or it's an extra 250 hours you can take off, or you can just be less rushed inside your clinic. But again, everything we do every day inside the dental clinic, it all comes down to time. And I find if you have a lot more time, if you're a lot more efficient, it's going to be better off in your mental health and in the health of the clinic on the long run. And remember, maybe one little item won't make a huge difference at first, but adopting multiple items throughout your day should make a pretty decent difference. So again, thanks a lot, and we'll talk about a different topic in the next